President Ibrahim Traoré has just made a bold statement to the entire African continent. With the launch of Africa's most advanced hospital in Bobo Dioulasso, Burkina Faso is now at the forefront of a healthcare revolution. This isn't just about a building, it's a powerful declaration. Africa is capable of leading in healthcare, of providing its people with world-class services without ever needing to look beyond its borders. Let's take a moment to grasp the true magnitude of this achievement. This hospital is more than brick and mortar. It's a symbol of what we, as Africans, can achieve when we believe in ourselves. It's equipped with cutting-edge diagnostic tools, advanced surgical technology, and specialized departments for trauma, maternity, pediatrics, and oncology. This facility is built not only to address routine ailments but to handle the most complex medical cases, the kinds of cases that used to be sent overseas. Not anymore. President Traoré, known for his firm stance on self-reliance and Pan-African empowerment, envisioned a future where Burkina Faso could lead the continent in healthcare innovation. This hospital is a realization of that vision. From its design to its operational model, everything about it reflects African excellence, independence, and pride. It's important to recognize who is running this hospital. The doctors, nurses, and healthcare professionals are trained locally. For too long, we have believed that Africa's best minds need foreign education to succeed. But the talent is here, homegrown and world-class. These professionals have been educated in Africa by Africans and are fully equipped to serve their communities. What sets this hospital apart is not just the technology or the infrastructure. It's the mission. This hospital is for everyone. From expectant mothers to cancer patients, from newborns to the elderly. It is inclusive, accessible, and dedicated to serving all layers of society. It represents the kind of comprehensive care system we should strive to replicate across the continent. More than a healthcare facility, this hospital challenges decades of dependency. For too long, African healthcare systems have leaned on foreign aid, foreign expertise, and foreign infrastructure. The wealthy traveled to Europe, America, or Asia for treatment. This not only drained our economies but perpetuated a narrative that we couldn't provide for ourselves. With this hospital, that narrative is being dismantled. The flow of money and knowledge no longer has to leave Africa. Now it stays here, generating jobs, boosting local economies, and encouraging further investment in our health infrastructure. That's what economic independence looks like. And there's a deeper message. This hospital is about more than medicine. It's about empowerment. It's about shifting the mindset of an entire continent. President Traoré is telling us, Africa doesn't need to wait for foreign help. We can lead. We can innovate. We can care for our own. This hospital is also an educational hub. It will train future generations of African doctors, ensuring that the knowledge, skills, and leadership remain on the continent. No longer will our brightest minds have to seek opportunity elsewhere. They can stay. They can thrive. Right here at home. As this facility begins to operate at full capacity, it will inevitably become a reference point for other nations. It already stands as a model of what is possible when leadership, vision, and national will come together. Healthcare reform across Africa must look to this as a blueprint. No more excuses. If Burkina Faso can do it, so can the rest of the continent. This hospital was not built by foreign donors. It was not imposed by international organizations. It was built with purpose for the people. This is African ownership at its finest. A healthcare system shaped by our needs, our challenges, and our dreams. Already the continent is taking notice. Governments, health ministers, and policymakers are looking to Bobo Dioulasso as an example of what healthcare can look like in Africa. The impact won't stop at national borders. This is the beginning of a continent-wide movement. Imagine what happens when hospitals like this exist in every African country, when no one has to fly overseas for treatment, when people trust and believe in the care available within their own borders. The potential is limitless. This isn't just about building hospitals. It's about building belief, about building systems that work for us, built by us, about creating a future where African doctors lead in research, in surgery, in public health innovation. We have the talent. We have the drive. And now we have proof. This facility is also transforming how the world sees Africa. For far too long, global media has focused on Africa's deficiencies. But with this hospital, we flip the script. the narrative changes. Africa is not just surviving. Africa is building, leading, and excelling. Soon we might even see medical tourism flowing into Africa instead of out. This hospital is that good. It's a symbol of excellence and it sends a clear message. Africa can provide world-class care. It also calls for us to reflect. When we have facilities like this in our own countries, will we still choose to go abroad for treatment? Or will we support our own systems, our own people? President Traoré has shown leadership. He's made the investment. He's built the foundation. Now the question is, are we ready to support it? Will we choose to trust in the healthcare being built at home? Every time we travel abroad for treatment, we send money out of our economies. We deny our systems the chance to grow. But when we stay, when we support, when we invest, we build. Supporting national healthcare is about more than using the facilities. It's about spreading the message, believing in the vision, demanding excellence and holding leaders accountable. It's about creating a culture where African systems are trusted, celebrated, and continually improved. This hospital is just the start. It's the first spark in what can become a wildfire of progress across the continent. From healthcare to education, from energy to technology, we now have a model. Let us all ask, will we embrace this change? Will we build on this momentum? Will we stand behind our leaders when they invest in national systems? The answer must be yes, because the future of Africa depends on what we build today. And today in Bobo Dioulasso, we have built something truly extraordinary. This is more than a hospital. This is the beginning of a new Africa. An Africa that believes. An Africa that leads. An Africa that heals its own.